Hi, my name is Lindsay. I will be the examiner for an oral Mech exam today. It is October the 27th.
Hi, I'm CuiCui. I will be the examining. I'm 25.
And I'm Joelle, and I will be the videographer.
All right, how are you today, CuiCui?
Good.
All right, so first I'll be washing my hands before I put some gloves on. So what I'll be doing today in oral Mech exam, I'm just checking the structure and the function of your face and in your mouth and things like that. All right, so first I'm going to just look at your structure, make sure everything's in line, everything looks good. I see you are not a mouth breather, you breathe out of your nose. All right, so now I'm going to be touching your jaw back here, and what I want you to do, I want you to open and close your mouth like this. All right, I feel some popping back there. We can talk about that later. And all right, I want you to do a big smile to me. I'm going to be looking at your teeth, just like this. All right, they're all in there. They look great and clean. All right, can you close your lips like this? All right, no drooling. Symmetry looks good. All right, now what I want you to do, can you pucker your lips like this for me? Perfect. All right, I'm going to test the strength of it with this tongue depressor. So what I want you to do, just pucker and push against. Very good. Thank you. Okay. All right, and now I want you to smile again one more time like this. Good, your lips look symmetrical, everything looks good. And now what I want you to do, I want you to puff your cheeks, but try to keep your mouth closed, so like this. Hold the air in there. Good, and I'm gonna stick this up to your nose to see if there's any air emission. All right, everything's good. All right, and can you stick your tongue out for me? I'm just going to be looking at the color and the symmetry. All right, color looks good. Symmetry looks good. Thank you. All right, and can you stick your tongue out for me like this? Thank you. All right, and can you stick your tongue up like this? Okay, I see your frenum is a little tight. Thank you. All right, now what I'm going to have you do is stick your tongue out like this. All right, and try to push it against the blade. Perfect, nice and strong. All right, stick it out one more time, and then bring it back in. All right, retraction looks good. Okay, so now what I'm gonna have you do is stick your tongue to your left. So stick it out right here, and I want you to try to push it against the stick. Push it against, nice and strong, very good. All right, same thing, but on the other side. So move your tongue to your right and push it against. All right, very good. All right, and I want you to now stick your tongue out and point the tip up, like you're pointing to your nose. Very good. Now I want you to stick your tongue out again and point the tongue tip down. Like that. Okay, very good. Okay, now I want you to stick your tongue out like this and move it side to side as fast as you can. So like this. Very good, thank you. All right, now I'm gonna look in the back of your throat just to look at your tonsils. Say ah,
Ah. Ah.
all right, no sound, I just wanna look back there. Very good, your tonsils look a little big to me. We can talk about that later also. Now I'm gonna look at the roof of your mouth all the way at the top for any discolorations, growths, everything looks good. All right, now I'm going to test your gag reflex. So I just want you to open your mouth and stick your tongue out a little bit for me. Very good, no gag reflexing. Alright, and now I want you to open your mouth again, and I want you to say a big ah.
Ah.
Alright, perfect. Thank you so much. Alright, and that is it. Thank you so much. Okay, so now I'm going to have you say some sounds, and we're going to start with the sound puh. Can you say puh for me?
Puh.
Perfect. Okay, now what I want you to do, I want you to say puh as fast as you can. I want you to start when I say start and stop when I say stop. Are you ready?
Okay.
All right, ready, start. All right, stop. Perfect. All right, same thing as fast as you can, but we're going to say the tuh sound. Can you say tuh?
Tuh.
Perfect. All right, start when I say start and stop when I say stop. Ready, start. Wow, that was fast. Good job. All right, now we're going to say ka. Same thing as fast as you can. Start when I say start and stop when I say stop. Ready, start. Perfect, thank you. And now we're going to put them all together. So it's going to sound like pa-ta-ka as fast as you can. Can you say pa-ta-ka?
Pa-ta-ka.
Perfect. All right, fast as you can. We'll start when I say start and stop when I say start. Ready, start. Perfect. Thank you so much. I am Lindsay Frazier. I will be doing an oral mech exam. Today is October the 27th.
And I am Joelle, and I am going to be the client, and I'm 22 years old.
I'm CuiCui. I'm going to be the photographer.
Perfect. Okay. How are you today, Joelle?
I'm good. A little
Right.
nervous.
You'll be fine. I'll just be looking at the structure and the function of your face and in your mouth.
Will it hurt?
It will not.
Okay.
All right. So first I'm going to put on some gloves. All right. Just want to make sure you stay safe and I stay safe during this. All right. So first what I want you to do is just, I'm going to look at the symmetry in your face. All right. Put that. All right. I see that your mouth is open. Is that usually how you're positioned at rest? Yeah?
Usually,
okay,
yeah.
So a little mouth breathing. All right. All right, and what I'm going to do, I'm going to fill your jaw back here, and I want you to open and close your mouth. Okay, everything feels good. All right, now what I want you to do, I want to open your mouth. I'm just going to be looking at your teeth. Make sure they're all there. None missing. They're nice and clean. Perfect. Thank you. All right, and now what I want you to do, I want you to pucker your lips like this. All right, I want you to push against there. Very good. Thank you. And can you do a smile for me? Good, and I retract it like this, normal smile. Good, thank you. Okay, and now what I want you to do, I want you to puff your cheeks out, but hold your breath in. And let's see that. Okay, I see some air coming out of your nose. Thank you. All right, now I'm going to be looking at your tongue. Let's see. All right. Some little grooves on your tongue. Color looks good though. Thank you. Alright, now what I want you to do, I want you to stick your tongue out and push it against the stick. Alright, nice and strong. Thanks. Alright, now what I want you to do, I want you to stick your tongue up. Try to point it. Okay, thank you. It's a little short. Alright, now what I want you to do, I want you to stick your tongue out to your left, and I'm going to push on it. If you can push against the stick. All right, nice and strong. All right, same thing, but on the other side. So stick the tongue out to your left, your right, thank you, and push it against the stick. Oh, sorry. Thank you. Okay, so I want you to stick your tongue out again and up. All right, and then out and down. Perfect, thank you. And then can you stick your tongue out and move it side to side like this? Perfect, thank you. Now I'm going to be looking in the back of your mouth just to check out your tonsils. All right, I see they're there. Thank you. And I'm going to be looking up at your palette for colors and growths. All right, I see some discoloration. We can talk about that later. Now I'm going to check your gag reflex just a little bit. You can take your tongue out. Perfect. Thank you. And now what I want you to do, I want you to open your mouth and say the sound ah.
Ah.
All right, thank you. Perfect. Is that too bad? All right. So now I'm going to have you say some sounds for me. So the first sound we'll be saying is the sound puh. Can you say puh for me?
Puh.
Perfect. All right, now what I'm going to do, I'm going to have you say it as fast as you can. I want you to start when I say start and stop when I say stop. Are you ready?
Yep.
All right, ready, start. All right, stop. Thank you. All right, same thing as fast as you can, but for the sound tuh. Can you say tuh?
Tuh.
Great. All right, ready, start. Thank you. Same thing for the sound ka. Can you say ka?
Ka.
All right, you ready?
Mhm.
Start. Stop. Thank you. And now we're going to put them all together and say pataka. Can you say pataka?
Pataka.
Perfect. Same thing as fast as you can. Start when I say start. Stop when I say stop. Ready, start.
Pataka, 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 pataka.
Thank you. All right, that's it. We're done.
All right. Today is October 27th, 2016, and we will be doing an oral mech exam. I am Joelle Wildman, and I am the examiner.
I'm Lindsay Frazier. I'm the examinee.
This is CuiCui. I'm the photographer.
Okay, so before we get started, I just used some hand sanitizer, just for both of our safety, and then I'm going to put some gloves on as well.
Okay.
So in this oral mech exam, I'm just going to be checking on the structure and function of your mouth and your facial structures, just to see if there's any issues that need to be noted. It shouldn't hurt at any time, but if it does, just let me know and I will make note of that and I will stop what I'm doing.
Okie doke.
Alright, so first I'm just going to look at your face at rest. Okay, looks good. Alright, so can you open and close your mouth? One more time. Good job. And then if you can move your jaw left to right. Alright. I'm just going to feel, and just open your mouth slowly. Okay. Then I'm going to look at your teeth just for a second. So if you just open your mouth, I'm just going to run the tongue depressor. All right, and if you can just bite. All right, I noticed a little bit of an overbite, but I also noticed that you have some orthodontic devices, so I'm sure that that is being worked on. And your dental hygiene looks good. All your teeth are there. All right, I'm going to have you pucker like you're going to give someone a kiss. Okay. Just going to test the strength. So you just push against this and don't let me push back. All right, looks good. I'm going to have you do pucker and then smile. Back and forth about 3 times. Pucker, smile. There you go. Good job. Alright, so then if you can just smile like you would for a picture. Alright, I notice a little bit of weakness. A little bit of drooping on the one side. Alright. And then if you can just one more time do the pucker to smile. Thank you. All right, so now I'm going to have you puff your cheeks like you're holding in a secret. So I'm going to take a big breath, hold your cheeks. All right, I'm just going to put some pressure against those. All right, and now I'm going to do it one more time. I'm going to see if you have any air coming out of your nose. Looks good. Looks like a good closure. All right, now I'm going to have you stick out your tongue. I'm just going to look at it with my flashlight. Maybe open it around just a little bit more. There you go. All right, so it's a little bit of a twitch. I'm going to make note of that. Your color looks good. And the size looks good. And then if you could just take your tongue tip and put it up to the roof of your mouth. I'm going to look at your frenum. All right, looks good. All right, if you could just stick your tongue out like you're licking a lollipop. All right. Okay. And then if you could just take it from left to right a couple times. All right, good range of motion. And do that as fast as you can. Really good. Okay. Just stick it out as far as you can. And I'm going to push against it. Don't let me move it. Okay, good job. All right, now I'm going to have you stick it out and then pull it back in. Do one more thing. There you go. Good job. All right, now I'm going to have you move your tongue tip to the right side of your outer lip. All right, I'm going to put some pressure on it. Don't let it move. I want to do it on this side too. All right, now go to your left side. All right, so good tongue strength. Good range of motion. All right, if you could move your tongue tip up towards your nose. All right, and then down towards your chin. Good job. All right, and then if you could just do side to side motion. Thank you. I'm going to look on the back of your throat. So just open up. Okay. Color back there is good. It looks like you still have your tonsils. They have like a good healthy size. Mm-hmm. And then we're going to look at your hard and soft palate. So open your mouth and kind of look up a little bit. I'm just looking for growths, discolorations. All right, looks good, looks wide, looks nice and high. Good job. All right, I'm going to check your gag reflex. All right. All right, and then I'm going to have you say, ah, and hold it.
Ah. Ah.
All right, thank you. All right, and we have one more test, and it's just to look at some of your sound rates. So I'm going to have you say the sound pa. Can you say pa?
Pa.
All right, I'm going to have you say that as clear and as fast as you can, and I'll say start and go. So, are you ready?
Yes.
Go.
Pa 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 pa.
Okay. All right, now we're going to do the sound ta. Can you say ta?
Ta.
All right, good. As fast, as clear, and as clear as you can do it. Ready? Go.
Ta 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 ta.
Good job. And we're going to do ka. You say ka?
Ka.
All right, so it's fast and clear. Ready? Go.
Ka 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 ka.
Good job. And now we're going to put all three of those sounds together. So it's going to be pa, ta, ka.
Pa ta ka.
So it's fast and clear. Ready? Go.
Patika 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 patika.
Good job. This is Joelle. It is October 27th. I'm going to be the examiner of CuiCui in an oral mech exam.
Yeah, I'm CuiCui. I'm the examiner.
And I'm Lindsay, the videographer.
All right. So I just sanitized my hands. I'm going to put gloves on to protect both you and I. So I'm just going to be looking at the structures and functions of your oral and facial mechanisms.
Okay.
Nothing I do should hurt. If at any time you are in discomfort, let me know, and I will make note of that, and I will stop immediately what I'm doing.
Okay.
And if you have any questions throughout, just let me know.
Okay.
I'll try to explain what I'm doing as I'm going, just so I'm nothing of surprise. All right, so I'm just going to look at your face at rest. All right. Good symmetry. All right, so now if you can just open and close your mouth at a nice, good rate. Open, close. All right, and I'm just going to feel right here. Keep opening and closing. All right, thank you. All right, so I'm going to look at your teeth. I'm just going to use a tongue depressor and just kind of feel along your teeth. It shouldn't be painful, like I said. So just open your mouth wide. All right. Then if you can just bite together. All right, thank you. I do notice that you're missing a tooth near the front of your mouth, so I'll make note of that. And it looks like you have good oral hygiene. Did you have braces? No? Okay. All right. If you could just pucker your lips like you're gonna do a big kiss, like. All right, I'm just gonna. All right. Good. And then if you can go from a pucker to a smile, back and forth like this. Okay, good job. Thank you. All right, and then smile as big as you can. Thank you. All right, now I'm going to have you put a big ball of air in your teeth or in your cheeks, and then close your mouth really tight, like a big. All right. All right, you can let that out. Let it out. There you go. I'm going to have you do it one more time. I'm just going to check to make sure that no air is coming out of your nose. So do it one more time. Thank you. All right, now I'm going to just look at your tongue. So just open your mouth. All right. Looks like a good size, good color. All right. And then if you can just stick your tongue out, straight out. And just stick it out and hold it out. There you go. Good job. All right, now stick it out as far as you can. Just one solid time. Okay, thank you. And then, just like you were doing, as fast as you can. Okay, good job. Thank you. All right, now I'm going to have you take your tongue and put it towards the right side of your mouth. All right, and now we're going to go to the other side. Put some pressure, don't let it move. All right, thank you. All right, so I'm going to have you put your tongue tip up as far as you can towards your nose. All right, and then down to your chin as far as it can go. Alrighty. Alright, now I'm going to have you stick your tongue out and go back and forth between the corners of your lips as fast as you can. As fast as you can. Alright. Alright, now I'm just going to have you open your mouth. I'm just going to look into the back of your throat. So, alright. Can you stick your tongue just a little bit? Let's stick it out just a little bit. Alright. So, tonsils look good. Good color as well. Alright, so we're going to look at your hard and soft palate. So I'm going to have you open your mouth and look up just a little bit. Alright, so you have good width, good height. You can see your alveolar ridge. Notice coloration. Alright, thank you. Alright, now I'm going to check your gag reflex. So I'm just going to put this in on your tongue, and if you, like I said, if you feel any discomfort, just either back up or just let me know. Alright. So you have a little bit of hyperactive gag reflex. And then we're going to do one last thing. If you can just open your mouth and say, ah, and hold it. Thank you. And if you can just do that one more time, I'm just going to check your nasal emission. All right, good. All right, so we are done with the oral mech part. Now we're just going to do a little test of some sounds. So I'm going to have you say the sound puh. Can you say puh?
Puh.
Puh. I'm going to have you say that as fast and as clearly as you can. So I'll say start and stop. Are you ready?
Okay.
All right, ready? Go. All right, thank you. All right. Now we're going to do tuh. So, like I said, as fast and as clear as you can. So, ready? Go. All right, thank you. Now we're going to do the sound cuh. Can you say cuh?
Cuh.
All right, so again, as fast and clear as you can say it. Ready? Go. Thank you. All right, this time we're going to combine all three of those sounds to say pa, ta, ka.
Pataka.
So ready? Go. All right, thank you. All right, you did a really good job. Thank you.
I'm going to be the examiner for the artificial mechanisms. This is my client.
I'm Joelle, and I am 22 years old.
And I'm Lindsay, the videographer.
Okay, how are you, Joe?
I'm good. How are you?
Good. Okay, today we're going to examine your face, mouth, and tongue, and something, and to make sure everything is normal. So wash my hand. Okay. First, I'm going to examine your face. Okay, relax. Okay. Very good. Okay. Can you open mouth? Okay, can you make it bigger? Okay, close. Okay, good. And can you open? Yeah. Okay, that's normal. Okay, now I'm going to examine your teeth. Can you open your mouth? Okay. Yeah, good. And can you have a smile for me? Yeah. Okay. Good. Okay. Now, can you park your lips? Yeah. Okay, very good. Now, can you have a smile again? Yeah, very good. Now, can you puff your cheeks and hold air? Okay. Very good. Can you do it again? Okay, no air. Very good. And I'm going to examine your tongue. Can you open mouth? Oh, the color seems okay. And can you open again? Okay. Very good. Okay. Can you protrude your tongue back in? Okay. Very good. Can you move your tongue to the right? Left? Okay, very good. Tape up to your nose. Yeah, okay. Can you put your tongue down to the chin? Oh, that's not very okay. Can you move your tongue side to side as far as you can? Yeah. Okay. Okay, I'm going to say your pharynx. Can you open mouth for me? Okay. Oh, okay. Good. Okay, now I'm going to say your hard and soft palate. Can you open mouth? Can you say ah for me? Ah. Okay, very good. The color, yes. Okay. Now, can you say ah and hold it for me? Okay. The outer is little. Okay. Okay, last lesson. We're going to say the sound p. Yeah, and you say it as fast and clear as you can. Okay. I say ready and go. Ready, go. Oh, okay. And now, t. Can say it? Yeah, and as clear as fast. Yes. Ready, go. Okay. Now we're going to say k. K. Okay. Simpson. Ready? Go. Okay. Now we'll put all three together. Can you say as fast and as clear as you can? Okay. Ready? Can you say it again? One time. P, t, k. Okay. Ready? Go. Patika, 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 patika. Okay. Thank you. Very good. All done.
All right, thank you.
This is CuiCui. Today is October 27. I'm going to be the examiner for the artificial mechanisms. This is my client.
I'm Lindsay, and I am 28.
And I'm Joelle, and I will be the videographer.
Okay. How are you today?
I'm good, thank you. How are you?
Okay. Good. Today we are going to do some examination.
Okay.
And with my hand. Okay. It's easy. Relax.
Okay.
Okay. Can you sit straight and relax? Okay, I will see. Okay. Very good. Can you open your mouth? Oh, close. Open and close. Open, close. Okay. Can do it again. Okay. Very good. Okay, now I'm going to see your teeth. Can you open your mouth? Yes. On here. And can you have a smile for me? Oh, sorry. Okay, very good. Okay. Can you pack your lips for me? Very good. Can you have a smile for me again? Okay, very good. Can you puff your cheeks and hold air? Good. Can you do it again? Oh, I see some air. Okay. I'll check your tongue. Can you open your mouth? Okay. Okay. Seems good. Okay. Can you protrude your tongue? Okay. Back in. Protrude. Do it again. Okay. Very good. Can you move your tape to your right? Okay. Very good. Can you do it to the left? Good. Can you put your tongue tape up to your nose? To your nose? Okay. Can you put your tape down? Okay, very good. Can you put it side to side? Very good. As fast as you can. Very good. Now I'm going to see your pharynx. Can you open your mouth? Okay, very clear. Very good. And I see your hard and soft palate. Can you open your mouth for me? Okay. Sorry. Okay, very good. Can you say okay, very good. Okay. Last then, we all pronounce. It's okay. pronounce some sounds.
Okay.
And for example, can you say
I'm gonna clip it. The gag reflex.
gaggery? Which one?
The gag reflex.
Gaggery.
Right? But we'll just clip it, so then just keep going.
Okay.
So
yeah, just start at gag reflex and do the rest from there down.
Okay.
So do well, she already did before on the previous page.
I would still do it just again, just so the flow is
Okay.
there.
So do gag reflex and then have me say
I just say
Yeah, before.
Yeah.
So what should we do? We could do again?
maybe from here. Hard and soft palette.
So for
Okay.
hard and soft palate, you don't have to have her say ah. You really
Yeah.
just need to look at the roof of her mouth.
Okay.
So then I would just do that, and then gag reflex, and then ah. So then
So-
there's more of a flow to it.
So look at the roof of the mouth, gag reflex, put the thing on my tongue, and then ah.
Okay.
So yeah,
Okay.
just do ah at the end. You don't need to do it both times.
Okay. So I'll just clip it. So
She'll make it
Thank
flow.
you.
Yeah,
No, you're good.
Okay. Now I'm going to see your hard and soft palette. Can you open mouth? Okay. Okay. Can you say ah for me?
ah.
Okay. Very good. Sorry. I forgot.
Oh, close.
My God.
Okay, so it's three things. It's look at my palette.
So you're gonna look at the
So you're just gonna look. You don't say ah,
Uh,
and then you're gonna stick this in my mouth and say I'm gonna do your gag reflex.
okay.
Or just put on my tongue, and then you're gonna say ah,
Okay.
right?
Yep.
Yeah. Okay, so look at my palette, and then turn the page, and then okay.
Okay. Okay, now I'm going to examine your hard and soft palates. Can you open your mouth for me? Okay, that's good. Okay. Can you say ah for me?
Ah.
Okay, very good. Okay, very good. The last thing, we'll pronounce some sounds. And can you say p?
P.
Okay. And can you say it as fast and clear as you can? And I will say start and ready, go. Okay. Ready? Go. Okay, stop. Can you say t for me?
T.
Okay, as fast and clear. Ready? Go. Okay. Very good. And k.
K.
Okay. Ready? Go. Okay. Very good. And now we'll put all three together. Can you say p-t-k? Very good. And as fast as you can. Ready? Go. Okay. Very good. You did a very good job. All done.
Thank you.